and thank you for joining us for this Lancet moment. Today we are exploring cancer awareness, and in particular cervical cancer. Joining me in studio today is Dr. Chris Maskey from Lancet and Alison Martin from UDoTest. Welcome.
Thank you.
Thank you.
So we've been hearing a lot about cervical cancer. Is this a new disease, or maybe you can tell us the history of it?
Absolutely. Thank you, Diasha. It's cervical cancer, we are hearing a lot about it, and it's being publicized a lot more. But in fact, this is a disease which is as old as time. And there is a fascinating history behind this because it has a very specific epidemiology or in the people that it affects. All right. So in fact, if you go back to the old medical text, one can see that there is some mention there of certainly it affects women because it's the cervix. And the other thing is it was noticed quite hundreds of years ago that the disease doesn't affect nuns, which is interesting. So there was already a long time ago some association put between cervical cancer and sexual activity, which is interesting. Beyond that, throughout the 1900s, we have seen an incremental growth in knowledge about cervical cancer. Another interesting fact is that cervical cancer was the first cancer to be grown as a cell outside the body. So it has, in fact, and that goes back to the early 50s, where a sample was taken from an African-American woman called Henrietta Lacks. And the sample that was taken was then grown. In fact, that cell line, which is called HeLa, after Henrietta Lacks, the first two letters, is still growing in laboratories all over the world today as an immortalized cell line. It's been one of the standards that we've used to not only develop an understanding of cancer, but also treatments not only for cervical cancer, but for many other cancers. And as we've gone over the decades, we have incrementally grown in our knowledge of what actually causes cervical cancer and an understanding of that disease process.
So leading into that, do we know what causes it?
Absolutely. I mean, if one looks at the causes of cancer in general, there are associations with many different cancers that one has risk factors for. But cervical cancer is the one where we have an incredibly specific risk factor and causative agent that leads to the disease. And this is in fact a virus. So cervical cancer is caused by a virus. And the virus that causes it is something called a human papillomavirus. It is a viral particle that infects the cervical area. And what happens over a period of time is that the virus causes a change in the cells within the cervix, which go from normal and over a period of time can lead to pre-cancer and then ultimately cancer. Now, this process of human papillomavirus, or HPV as we refer to it, is in fact quite a long process. All right. So in other words, if you are exposed to HPV, it takes at least 10 years for you to develop the pre-cancer and sometime after that to develop a cervical cancer. Now, the important thing about understanding this timeline that we have is that if a woman is exposed to HPV, there is a long period in which we can not only identify that woman's risk, identify whether she is progressing to cervical cancer, but we can actually intervene as well. And so because of that wonderful window period that we have in this disease, no one should ever really get cervical cancer. Now, it is that process of development over time. Now, most women who are exposed to HPV, I will say here, it's not only women that are exposed to HPV because men are as well. It just happens that the disease manifests in women more often than it does in men. Now, if women are exposed to HPV, in fact, most of them will never know about it. So 80% of women will clear HPV, the human papillomavirus, from their bodies just using their natural immune systems. Unfortunately, it is the 10 to 20% in which that infection is not cleared, and where you get persistent infection within the cervix, and it is that persistent infection which over time can lead to the process of pre-cancer and ultimately invasive cervical cancer.
So who would be mostly at risk?
Okay, so the answer to this is quite a scary revelation, actually, because if you have a look at human beings, okay, I'm talking about everybody here. In fact, between the age of 20 and 30, 70 to 80% of us are exposed to HPV. Okay, so in other words, there is no stigma that we can attach to this because it is virtually a consequence of being human that you will be exposed to HPV. How do you get exposed? It is through sexual contact, and that is the truth of it. Now, the thing about HPV is that it's an incredibly hardy virus. It's very difficult to kind of just sort of wipe away, all right? Which means that contact with HPV doesn't necessarily have to result from penetrative sex or unprotected sex. Okay, condoms are partially protective, and one should always practice safe sex methodologies. But in fact, in the case of HPV, it is not always protective. So to answer the question, who is at risk for cervical cancer, it is virtually everybody, okay? Virtually all women, all right, because of that high prevalence of exposure in our early years. It doesn't mean that all of those women are going to develop cervical cancer in the end, because only a small proportion of them will not actually clear their infection using their own immune systems. Okay. But it does mean that all women need to screen themselves and protect themselves against developing cervical cancer.
So there's been a lot of education recently around cervical cancer. What are the ways to prevent it?
Okay, so essentially we cannot stop exposure, all right? We can limit exposure as much as possible. And it is true that the risk factors for being exposed to HPV are the same as risk factors for any other infection or agent that might be transmitted through sexual activity. And one can practice safe sex, condoms, all that kind of stuff. But with HPV, it is not 100% protective. So beyond that, we have to screen our female population for cervical cancer or the risk for cervical cancer. Now, what we have done with that over many, many decades is to use a test, a laboratory test called the pap smear. And of course, this is going to be familiar to all women and I do hope that most women, or in fact all women, would have had a pap smear before, which involves taking some cells from the cervix, examining the cervix, taking some cells from the cervix, putting them on a little glass slide, and what actually happens to that, it goes to the laboratory and it is examined under a microscope to look for the changes which result in the changes of pre-cancer, essentially. All right. And if there are the changes of pre-cancer and infection with HPV, then that woman is put in a program either for treatment or for vigilant screening to make sure that she either clears the infection or doesn't develop cervical cancer. So we've been doing pap smears, this cytology test, for decades now. And what we saw as soon as the test was introduced was that the incidence of cervical cancer went down. Okay, that was fantastic. But we have a lot of information now to tell us that we've reached a glass ceiling. Okay, so there are two factors which determine whether we are going to reduce the incidence of cervical cancer. The one is that the number of people that actually go and get screened. Okay, so if every woman in the population went and got screened, we would dramatically reduce the incidence of cervical cancer. But there is a fly in the ointment, for want of a better word, in that the way that we are screening for cervical cancer using the pap smear, we know is not perfect. Okay, so let us take an example of somewhere where it should be as good as it gets. If you have a look at Scandinavian countries where there are very good health records, okay, in addition to that, there is excellent screening service and access to the screening service where literally you will get a letter in the mail to say that you are due for your screening event, and if you don't go, it is followed up. So it is a very controlled environment where you have more than 90% of women in the population actually being screened. Question is, in those environments, in those countries, have we actually reduced or removed cervical cancer? We've certainly reduced it, but we haven't removed it. We haven't got rid of it. And that is because of quite a scary statistic, which is if you look at women who are actually diagnosed with cervical cancer, around 30% of them had a normal test in the previous 3 years. All right. And what that tells us is that our testing methodology is just not good enough. So we are evolving now from a era where we have been doing pap smears to a much more sophisticated methodology, one which is based on the fact, based on our knowledge of what causes the cancer, which is this human papillomavirus. And we are now able to detect the human papillomavirus using its genetic material, its DNA. And we can do that in a much more sensitive way. And when I say sensitive, we pick up many more cases. And not only that, we actually determine whether the HPV that is present in someone is actually dangerous, because most of them are not. There are only 14 types that are linked to the development of cancer. And within those 14 types, there are two. One is HPV 16, which is the most important, and the other one, HPV 18. These are strains of the virus. Now, these two strains of the virus are responsible for 70% of the disease. Okay, so we really want to know when someone is at super high risk as opposed to just being at risk. Okay. And with these new genetic tests that we are doing, we are able to do that. Not only give someone a positive result when they're at risk, but actually stratify that risk according to whether they have HPV 16 or HPV 18. Now, the great thing about these tests is that we can apply them to so many different situations. We are doing them on samples which would be the current experience of having a pap smear, a sample from the cervix, and that is incredibly effective at picking up women at risk. The other thing that we are doing is in fact applying it to samples which are self-collected by women. So in other words, these are samples which have not been collected by a healthcare worker, but actually can be collected at home. I'm going to ask Alison here to expand on that, because that is, I think, is an extremely exciting development in our campaign to increase access to screening for cancer.
Thank you, Chris.
So Alison Martin, thank you for joining us. And you're part of UDoTesting, and UDo is at the forefront of self-testing. So maybe you can talk us through self-testing a bit.
Thank you. We've been around for the past 2.5 years, formed in 2012. And basically, we're passionate about HPV, and we're passionate about getting women screened. And we knew there was a limitation on South African women, specifically either access to healthcare, knowledge on HPV, women not going for their annual screenings. And we really wanted to make a solution that was convenient, accurate, and safe for them to do themselves. So UDoTest, we provide a complete start-to-end process with which a woman can get screened in the comfort of her own home, or doctor's room for that matter. It can get analysed in accredited laboratories as well as reviewed remotely by their doctor. And we provide them with support, with referrals, with any assistance they may need. Okay. But essentially, UDoTest, we wanted to bring home testing or self-sampling to South Africans, and we wanted it to be in a way that they understood, because we recognize that HPV is extremely prevalent, extremely dangerous, and women are not alert and not educated on this. So yes, we're helping a lot of women, and thanks very much to Lancet.
So maybe you can talk us through how someone actually uses the test.
Okay. A lady can either purchase a test on our website, that's udotest.com, udotest.com. The tests are also available through retailers, through Clicks and Dis-Chem pharmacies, the nursing sisters there. And lastly, we also have tests available through selected doctors' rooms. And what a lady would do is, once she receives our UDo HPV test, it literally would take her 30 seconds to do, either in a bathroom or any place of her convenience. The test itself is a dry swab or a brush. And basically, a lady would take it out of its packaging. It's called the Evelyn brush, and it looks like a pen, and it works similar to a pen too. What a lady does is stands in normal standing position. She doesn't need to lift her leg or do anything awkward, but essentially she would take off the lid, insert the Evelyn brush into her vaginal walls only as far as here. We frequently get asked if you need to insert it as far as the cervix. That's not the case, just vaginal wall is fine. As far as here, once inside, a lady pushes the bottom of the pen up so that the bristles are literally touching the vaginal walls, and rotates it 3 to 5 times. simply by rotating the bottom here. And this is actually quite a soft brush. It's only inside of her for 10 seconds anyway. What then happens is she removes it, she puts all the bristles on the inside, replaces it with the lid, and she's done.
Okay.
From there, a lady would log a collection with UDoTest. We would conveniently collect it at whatever time is suitable for her. And she would receive her results within 5 working days, all from doctors and counselling services if need be. But essentially it's a convenience service for her to no longer have any more hurdles stopping her from getting tested.
So it's nice, it's convenient, you've got a network across the country, so it's easily accessible for any woman to go and get it and test it from.
There's officially no more excuse for us.
Yeah.
Yeah.
So I know that there's been a campaign for screening for cervical cancer for the last few years. What's the success of that campaign been?
So I think, I just, to make a comment about what Alison has said, we, in tackling this problem of cervical cancer, which is still, it is still a major problem, even though it's an old disease, it is still with us. It is the second most prevalent cancer in women in South Africa, second to breast cancer, and literally thousands of cases a year are diagnosed. So the solution to that is really we need to throw every little bit of technology and innovation to this. And I think that not only the innovation in the testing, focusing on HPV, which is the actual cause of the cancer, but this type of innovation as well, where you expand access to people where there are certainly limitations in access and resources within our health system in general. This is just an absolutely fantastic innovation. So, we have prioritized cervical cancer as one of the big cancers which is both preventable and something that we can really start doing something about. So about 4 years ago, we adopted the newer technology, the next generation screening technology, which is the HPV screening test. And in addition to that, we, in partner with the supplier of the test, which is Roche Diagnostics, we were able to greatly reduce the price of that test, which is a very sophisticated DNA test, but we've greatly reduced the price of that test to make it accessible to as many people as possible. Now, that campaign has been very successful. If we have a look over the last 4 years, in fact, the amount of people accessing this test has increased 5-fold. And that's fantastic. And we're only a fraction of the way of where we want to go to. One of the things about this test, which is just so important, both within a self-test environment or a sample which has been collected by your healthcare worker, is the great certainty that you have with it. Okay. And I'm not talking about the positive test, which we can deal with separately. I'm talking about the negative test. All right. Now, you'll know, and a lot of women will go for their yearly pap smear. Yeah. All right. It's a habit. Okay. On the 1st of July, you kind of book it in, and that's your yearly habit. And that is fantastic because you're keeping yourself safe. But it's something which is an ongoing thing. It's an inconvenience to you. And it's something which you have to do because we know the pap test is not perfect. So it's something that you have to do very frequently like that. Now, because the test that we are doing here, the HPV test, is so much more sensitive, if you have a negative test with the HPV test, it means that you can safely walk away for the next 3 years and come back for screening in that amount of time. And that is because a negative is a 99.7% negative risk. Okay, on this test. And that is incredible. I mean, it almost doesn't exist elsewhere in medicine, okay, to have such a strong predictive value on a test. So that is why it's so effective, and that is why it is so cost effective to actually do it. And we would encourage all women, I mean, as part of not only this campaign, but we would encourage all women to try and access a cervical screening event, whether it's through self-test or whether it is through your healthcare worker. Now, when do you actually do that? Okay, what we know is that cervical cancers start developing in the 30-year age group, 40-year age group, and 50-year age group. And in fact, in our country, the peak is in the 40s and early 50s. All right. In other words, this is a cancer of young women. All right. This is not something your granny gets, and it is also not something that happens to other people. Okay, because all women are essentially at risk of this. Okay. So we would say, and our protocols around this dictate, that we would encourage women to start screening with this test at the age of 25. And if you have a negative screening test, you can safely do your screening at 3 to 5 year intervals, and that is quite safe. If you have a positive test, one needs to deal with that in a way that then takes care of the risk that you in fact have.
Yeah. There is a vaccination for cervical cancer. So how effective is that? And when would you, so if I screened and I got a negative, would I then go and get a vaccination just in case, or how does it work?
Okay, I think that, yes, that vaccination is an incredibly important discussion around cervical cancer. I mean, we're talking about reducing the incidence of a disease by screening people and picking up those at risk. But in fact, the ultimate prevention of this is vaccination. Now, just to give you a parallel story around vaccination, if you go back 50 years, there was a high incidence of polio in the world. Okay, polio was a devastating disease and really affected so many young kids who would then develop paralysis and for the rest of their life. Now, through a very comprehensive and successful screening program, we have almost eradicated the world of polio. Okay, in the same way that we've eradicated the world of smallpox, and this has been through vaccination. Okay, so when you talk about vaccination in a disease, you actually talk about the potential of getting rid of it, all right, from the world. Now, with cervical cancer, unlike other cancers, we have this very definite and specific cause of the disease, and it's a virus, okay, which means that we can vaccinate against the virus, and that is exactly what we are doing. So we have had a campaign in place within the country, but also development within vaccine technology. There are 2 commercially available vaccines which vaccinate against HPV 16 and HPV 18. And as we discussed earlier, these are the most important causes of cervical cancer and account for 70% of the disease. So these are very effective ways of preventing the disease. If you give it, the main way to use the vaccine is to give it to young girls pre-exposure, all right? And the best time to give it is between the ages of 9 and 13. Now, there are 2 good reasons for this. The one is that it's pre-exposure, all right? In other words, you want to prevent before you actually get exposure, because that gives you the best protection. The other reason is that 9 to 13-year-old young bodies have this ability to generate great immune responses. Okay, and so one gets a very good immune response to the vaccine that you're giving, which gives a durable protection into your 20s and 30s when you are exposed to the virus. So vaccination really has the potential to be the most effective way to prevent cervical cancer. We are rolling it out within our schools. Which is a fantastic initiative from the Department of Health. It needs to extend further and further. Every young girl should be vaccinated for HPV because it is protective against a cancer, all right, which is very prevalent. Now, I want to tell you a story because I have spoken about cervical cancer quite a lot with different groups. And the strangest thing is that when you talk about, if you had to ask people, all right, in a room, okay, you had to ask women, you said, okay, if I told you that we had a vaccine for breast cancer, okay, how many of you would give that vaccine to your daughters, all right? And a sea of hands will go up, okay, because everyone, there's no one who will not protect their daughter against getting breast cancer, all right? And then you ask the same question and you say, all right, if we had a vaccine to protect your daughter against cervical cancer, all right, how many of you would do it, okay? Now, this is obviously a question that is asked after, a discussion around HPV, the fact that it is sexually transmitted. And then 1 or 2 hands go up, okay? And the others are all shaking their heads and going, no, well, my daughter's not like that, okay? And the point about it is that this vaccine is not a judgment, all right? It is protective. It is one of the greatest healthcare initiatives and innovations that we have in our generation, all right? The fact that you are giving that vaccine to your daughter at the age of 13 is because it gives her an excellent immune response. Doesn't mean that we're saying that your daughter is going to have sex at 14.
Yes.
And that is a very important message, and something which we just have to get rid of our judgment around this in order to protect more young girls and women from being exposed.
You touched on it earlier, but what would someone do if they did get a positive test?
Yes. Okay. So if one gets a positive test on this, one has to then deal with that in an appropriate way. All right. Now, just to explain what a positive test means with this test, okay? If you're positive for HPV, it means that you are positive for an HPV that is actually associated with the development of cancer, okay? But you have picked up a risk factor for developing cancer. It does not mean that you have cancer. Okay, it is a screening test. So exactly what we're trying to do is catch you many years before that ever becomes a problem for you. So it is not a test for cancer, it is a test for the risk factor. Now, if you are positive for that, one then needs to deal with it in an appropriate way. In other words, you need to see your doctor. Okay, and that is it. You have done a test, you've done the responsible thing by screening yourself, and you now need to see a doctor with that positive result, who will look at the positive results, who will look at, like I said, the genotyping or the specific strain, whether there's 16, 18 and that, and also look at other factors. So, for example, the doctor will likely examine the cervix, maybe take additional sampling in order to see a biopsy, for example. And that is sometimes done in a doctor's rooms, sometimes done in an operating theatre. Your risk of actually having anything serious kind of goes along with time and age. All right, so if you have a look, we spoke about this window period of 10 years, okay, roughly, from exposure to something serious actually being able to happen. Now, which means that if you are exposed at 20 and you've persistently been exposed to HPV or infected with HPV and you haven't cleared it, at the age of 30, you are getting into the stage where actually that risk factor is quite high. And if you're positive for HPV at that stage, you really need to deal with the positive risk factor, go and see your doctor so that you can be reassured or treated appropriately. Okay.
And what are the different treatments that someone would go for if they did have cervical cancer?
Most people will have very, very simple treatment. Okay. If someone is positive for HPV but doesn't actually have any significant changes in the cervix that are going on, in other words, they're very early in the stage process, they can be safely watched over time, screened again vigilantly to make sure that it doesn't progress, and that is a very safe way for women to manage that risk and for doctors to manage that. Okay, and for many women, that is all that it will involve. For women who are positive for HPV and have changes within the cervix, in general what would happen would be they would have an examination of the cervix with a kind of a little microscope thing which is applied. They will see, the physician who is doing that will see whether they can actually see any changes on the cervix and will remove those. It's kind of like a little lasering off. All right. Once that is done, all right, that is then removed. All right. So in other words, it's an incredibly simple treatment, not something to fear, not something to avoid, because it is a one-day procedure and essentially you can remove your risk of progressing further. After that treatment, one does then have to follow up, all right? You need to continue seeing your doctor because it might recur, all right? Until a point where you have safely been through a few years of negative results and it is probably taken care of and gone away. In some cases where the problem has progressed a little bit more, they might actually cut a piece of the cervix away. That is done in a very clever way in which it doesn't affect childbirth and things like that. So in other words, this is not something which you need to avoid because you still want to have children. In fact, it's something which you want to take care of because it can be dealt with and the rest of your life can be totally normal, including fertility things and childbirth and all that kind of stuff.
So we've spoken about cervical cancer, but there are other cancers out there that we need to be aware of. So what are the things that we should be thinking of?
Well, absolutely. I mean, cervical cancer is just one in a number of cancers which people can be at risk for. We've dealt with the way to how to screen for and manage your risk for cervical cancer, but all women need to be aware of the risk of breast cancer as well. Okay, and so, you know, and I want to bring this up with regard to self-testing, and something that people need to be aware of. So when you self-test, okay, you are not going to your doctor or nursing sister or anything who at the same time might ask some questions about your health, may examine your breasts to see that there's nothing going on there, and have a whole lot of other stuff going on. So in other words, you know, when you are looking at your health, cervical cancer is one problem. One needs to deal with the risk of other things. And in women, breast cancer is the most common cancer in women. And it is a disease which increases in incidence with age. But certainly breast cancers can happen young as well. So examination of breasts is important. Going for mammograms as well, and taking care of that risk factor. And not only women, but in men, of course, one of the most common cancers in men is prostate cancer. One can have a blood test to look at your risk for that. And also men need to go and get examined. All right, from the age of about 50, it's important to either have the blood test or, in addition to that, actually have an examination of the prostate by your doctor to make sure that you don't have a risk or problem with that.
Okay, great. I think that brings us to the end of this chat. Any final words from you, Dr. Maskey?
No, I think, you know, the final word is just this. We have all of the technology, all of the ability to stay safe. But that does not mean that everybody is going to use that. So really, this is the amount of energy that you need to kind of get yourself to access this type of stuff is very low. It's something that you just have to put your mind to, but no one is going to do it for you. So it is something that, with the greatest technology on the planet to screen for these diseases, unless people use it to stay safe, it doesn't work.
Alison, any final words from you?
I share the same sentiments as Dr. Maskey. We're here to help women, to give them access, to take away hurdles which are currently limiting us from going for screening. Do not underestimate the dangers. We are seeing women sitting right next to us with infections. So please go online, read about it, don't delay, and please get screened.
That's it from this Lancet moment. I hope you have found it insightful. The UDoHPV test certainly does seem to be a great initiative. The test itself cannot be overemphasized in its importance. You heard the stats. Go and get the kit, do the test, and find out more. It takes moments and could change your life. Till next time, goodbye.